Today we're going to use a Suresult D3 Ultra to look for rib fractures. Now a lot of people, a lot of doctors, when they think of a fracture, they think radiographs, they think x-rays. And even myself, I was trained that way, but in fact, ultrasound is actually much better. But wait, ultrasound, that's soft tissue. But the cortex glows brightly, so you can see a discontinuity in the cortex. And soft tissue, you can see a hematoma underneath the periosteum. The periosteum gets lifted by basically fluid from the injury. So it is very, very sensitive. It's very easy to pick up a fracture with ultrasound compared to a radiograph. In fact, in one study specific to rib fractures, it was back in 2017, they found that ultrasound had a sensitivity, caught 98% of the fractures, whereas the oblique rib view and the PA chest radiographs detected 46 and 41% of rib fractures respectively. So that's very, very impressive. And in fact, there's a consensus statement that says if you have a patient and they've had radiographs, but you're like, I still have a clinical suspicion that they have a fracture, they say, oh, we'll get an ultrasound and satisfy your clinical suspicion. Because in general, ultrasound has a much higher sensitivity. Now, the downsides of ultrasound is you have to screen through, like you're taking a very narrow slice. So you have to really screen through the bones and look all around the bones. And there's some places you just can't get the unit. So you can't screen the whole body, every bone completely, because you just can't manipulate, the ultrasound unit around every bone. The other caution is you have to make sure you're not mistaking something like an osteophyte or an erosion or what's called a pseudo-erosion for a fracture. There's often a little depression where a ligament attaches, and you don't want to mistake that as a discontinuity of the cortex. And of course, children look really strange no matter what type of imaging you're using. So you don't want to mistake normal anatomy in a child for a fracture. And remember, you have both sides of the person, so scan both sides if you want to see a normal, and use your split screen. Specific to rib fractures, if you wanted to, for example, check the lungs for pneumothorax or hemothorax, you have the right tool in your hands already. Just take 60 seconds and you can check for those as well. Okay, so you may have no idea where the injury is. You may have to screen through every single rib, or you may have a clinical indication of sort of where the injury might be. And you may know exactly where the injury is because you're just following the injury and you're monitoring healing. In fact, it is recommended to follow fractures with ultrasound imaging because you can see the callus and you can basically watch it heal if you deem that useful. Now for the fracture, we want an image sort of perpendicular to the fracture line. Now, of course, we don't know where the fracture is if there is a fracture, but ideally we'll see that discontinuity as it sort of jumps across that line. So for ribs, we know where the fracture is going to be. The fracture is going to be sort of up and down. So we're going to go longitudinal along the rib. Now, how I'm going to do that is I can palpate and I can sort of feel and follow one rib, or basically follow the intercostal space because that's easier to follow. And then I can just basically have the transducer sort of follow just on top. And I can just follow along the rib, go down one intercostal space, follow along the rib. If you get lost, you can, of course, figure out where you are by taking a coronal view or a view sort of transverse to the rib. And you can look at the ribs because you don't want to be looking at the pleura of the lungs and think you're looking at the ribs. So it's a good idea to every once in a while turn it 90 degrees and make sure you're taking a picture of what you want. When you switch to cartilage, cartilage doesn't look like normal bone and cortex. You can't see through cortex and you can see through cartilage. So it's a striking change when you start to hit cartilage. In terms of patient positioning, if someone has a rib fracture, breathing probably isn't very easy for them. Moving around probably isn't very easy for them. So take an image in whatever position they're in. If they're lying on their side, if they're sitting, if they're standing. Nice thing about ultrasound is you can sort of work around whatever body position they're in if you have a handheld ultrasound. And let's just get into it. So I'll turn it on here, and I'll find a rib, and let's take a short axis view. We can see where that rib is, right? It stands up, and between the ribs we have the pleura. So you don't want to be in the pleura, you want to be the ribs, which are more superficial. So I can rotate this. So what I'm looking for is this cortex, and I want to make sure that it's continuous. and I can follow it, and follow it, and follow it, and follow it. There it is again, and follow it, and follow it, and follow it. And then at a certain point, you're going to hit the costochondral junction. Just double check where you are, what's going on. And you can see I go from not being able to see through the cortex, and then all of a sudden, now I can see through the rib, right? So now I'm at cartilage instead of bone. Now remember, it isn't just the fact that the cortex is continuous. You can also look above the cortex, right? And you'll have basically a hematoma and fluid basically lifting up the periosteum if there is a fracture. So keep an eye out for that as well. Now, if you want, you can go into a quick lung exam. I have another video for that. Or you can go to my website, and I think I have an hour-long video of trauma ultrasound that will explain how to do a trauma lung exam. But that's it for the ribs. And I'll just add that if you are interested in one of these ultrasound units by Suresult, that you can use the coupon code for 11% off. And they've also asked me to tell people that they tried their best to handle things like duty and shipping, and they've tried to make sure that it meets international standards. And if you have any questions, you can always WhatsApp them, and they're very responsive. Anyway, cheers.